Greetings and welcome to Mental Health Trailblazers, Psychiatric Nurses Speak Up. I am your host, Indrias Kassaye, and you are listening to Season 2 of the SAMHSA Minority Fellowship Program at the American Nurses Association's podcast, where we spotlight MFP fellows and alumni and their pioneering work to improve health outcomes for marginalized communities. We have so much to explore, so let's get started. Greetings, Lisvel, and welcome to Mental Health Trailblazers. We have a lot to discuss, so let's just dive right in. Let me start by asking you to please introduce yourself to our audience.
Hi, yes, thank you for having me. My name is Lisvel Matos. I am a Ph.D. student and an MFP doctoral fellow. I'm a Ph.D. student at Duke University, and I am just wrapping up my third year there. I am also a women's and family nurse practitioner.
Okay, and if you could share a little bit more about your background and how you got into the whole world of nursing. What motivated you?
I was raised in Miami, Florida. My family's from the Dominican Republic. My grandfather placed a lot of emphasis on education and opportunity, given that he was an immigrant and really strongly believed in the American dream. And so he really was kind of the one that always planted seeds and told me that I could go anywhere I wanted to go in terms of my education. When I was 17, my mom decided that it was time for a change, and so she moved our family from Miami to Charlotte, North Carolina. And that was a huge culture shock for me. I mean, grew up where most people spoke Spanish and a lot of different cultures around me, and people were very accepting of that. And so coming to North Carolina, I felt very isolated and just really confused about what my next steps were. And so I know my grandfather's voice was always in the back of my head, and I decided that I was going to try to take the SATs and go to college. I had actually dropped out of high school and decided to do a high school completion program, which I had already done before coming to Charlotte. And so I was like, okay, well, I guess I'll try to take the SATs. And I bombed those miserably. I'm not a great standardized test taker. And so I was like, okay, well, Central Piedmont Community College it is. And they had a really strong nursing program in particular, which I was drawn to.
What drew you to nursing?
Yeah. So I think I was always drawn to nursing as even a child, just because I was kind of a hypochondriac as a child. Like if I had a stomach ache, I would beg to go to the hospital. It was just kind of something I always wanted to do. The nurses were always so much more empathetic than even sometimes my family when they were taking care of me. And so nursing just always stuck in my mind as something that could make people feel better even in times when they, were sick. And I've always had such compassion of taking care of people and wanting to make a difference that I think nursing and me felt like a natural fit.
And then why psych and mental health nursing in particular?
Yeah, so when I had my first psych rotation in my associate's program, I was scared. I mean, the way psych is depicted on TV and in society, it just seems like this really dangerous place to go. And even other nursing students or nurses I don't, just dreading it. And my first day in psych, I was like a fish in water. I felt great. I had amazing conversations I was actually on the adolescent floor my first day. And given that I was pretty much an adolescent basically at that time, I was only 19 or 20. I don't know. I just felt like I could relate a lot to some of the experiences that my patients shared, some of the things that were hurting them, and some of the reasons that they found where they were. And it just made me feel this immense amount of just compassion, and it made me feel like this was an area that I could possibly see myself making a difference. And so I always held on to those experiences that I had through my psych clinical, and my first job out of school was as a psychiatric nurse at a level 5 treatment facility for young men.
From being a high school dropout, you are now a Ph.D. candidate at one of the leading universities in the world. How does that feel?
Amazing. It feels surreal. It really does. You know, I can't never put it into words. Who I thought I would be today or where I thought I would be versus where I am, it's just something that I'm incredibly grateful for every day.
And what would you attribute that to? What drove you to go from getting your basic license to work as a nurse to then pursue it further and further, and now you're doing your PhD?
That's a great question. So, one of the things is in life is like you can't be what you don't see, you know? And so, one thing that I've noticed with myself is that I go to school, like for example, to become a nurse, and then I'm like, oh, I'm going to do this next thing, and I'm going to do this next thing. And I've always asked myself, like, well, why? And I think that what has happened in my life is that every time I get to a new place, like for example, becoming a nurse, that kind of gave me, if you will, like the status of having an associate's degree. And that makes a difference if you're the first one to do that in your family. If this is the first time you've been exposed to other opportunities. And so I think that throughout my life, I have seen I guess, the fruits of my labor, if you will, that if I work hard and I try to better myself, that I will have these different opportunities to pursue. And I think I wasn't necessarily always thinking about it that way, but it is definitely something that has been these kind of different stages of my life where I'm like, oh my gosh, I didn't know I could do that. Becoming a nurse, I didn't really know that I could be a nurse practitioner. I had no idea what that path looked like. I didn't know that you could get your PhD in nursing when I was becoming a nurse practitioner. And so I've been incredibly blessed to be around people that care about me and care about my development and that allow me to kind of think through these things and help me be the person or be as ambitious as I want to be.
The field of nursing is, well, since COVID, of course, it's gotten a lot more prominence in the media, and there's a lot more discussion and talk about it being a lucrative career choice, and you're always in demand. But it's also a field that is dominated by white women, at least in America. And coming into the field as a Latinx Hispanic woman, what was that like? Were there any challenges, and how did you navigate those?
Absolutely, there have been challenges. I have never been the mold, not in nursing school, not on the floor. Less than 6% of nurses in the United States are Hispanic. Um,
Wow.
and so I think it's over 70% are white. And so being also that I live in a state that is, the Hispanic population is growing immensely, but I've almost always been kind of an N of one, of two within even the unit or the hospital that I've worked in. There's never really been that many Hispanic nurses. And so, how I express myself, my lived experiences, the way I approach nursing and my patients is completely different than some of the colleagues that I've had. And so, I've been stereotyped as the kind of like feisty, spicy nurse. And really, it's just because I was raised to express my opinion. Let me say that. And so I brought a lot of that into the way I operated as a colleague. And I thought that most people said what they felt and how they felt and kind of put things out there. And I found that culturally that I might be a little bit more forward than some of my colleagues, and that's not to say that I've always felt rejected by my colleagues. I have colleagues that have embraced me and wanted to know and get to know more about my culture, where I came from, just my experiences. But feeling like an other most days and having people's life also in your hands, it has been stressful.
How do you then take all of these challenges and make sure that the outcomes for the patients are not affected, that you have positive outcomes?
Yeah, that's a great question. So I really focused on patient care especially when I was a bedside nurse. And this it was not as true during my time in psych. My time in psych, I really worked with people that we felt like family. we looked out and we looked after each other. When I went to labor and delivery, there were a lot fewer nurses of color there, and I was working on a unit that just was very culturally insensitive. And so during that time of my career, I really felt like I had to put my head down and focus on my patients. And for me, a successful day looked like healthy moms and babies as much as I could, whatever was in my control to do. And so that's what I focused on.
And that's such an important space to be in the mother and child unit, because especially for people of color, because we see it in the statistics that African American women, in some, well, you have the Latino paradox, but in some instances,
Yep.
for example, with Puerto Rican mothers, you have really high rates of maternal mortality in this country. And so that was an important space to make sure that patient-focused care and good outcomes were there. And sometimes you find that part of the reason why these outcomes for these groups are as bad as they are is because of the kind of healthcare that they're receiving.
Correct.
If somebody's, I mean, you know better than I, if somebody's feeling pain and expresses that, and they're treated with suspicion that perhaps they're a junkie wanting, their daily fix of whatever.
Yeah. And a point to make around that is that I've seen how people that are generally like nurses that are good nurses, and honestly, I believe good people at heart, but how certain biases and certain things that people believe can affect their care. And my position as a nurse has always been I do not step onto that floor in any way, whether it's psych nurse, labor and delivery nurse. It's not my position to judge any of my patients. It's my job to do the best for my patients. And the types of things that I've heard on a nursing floor, like, well, if you don't come to this country, if you don't know how to speak the language or don't want to learn the language, or you shouldn't have, done drugs while you were pregnant, or, why do you have, this person has 6 kids and now they're having their seventh and they don't have custody. None of those conversations are appropriate or belong in the space of taking care of our patients. And I think, again, the reasons I get called, spicy and feisty is I'm not afraid. I've never been afraid to tell a teammate, that's not appropriate. You shouldn't say that.
Good for you. Thank you very much, Lisvel, and we will be right back. You are listening to Mental Health Trailblazers, Psychiatric Nurses Speak Up, brought to you by the SAMHSA Minority Fellowship Program at the American Nurses Association. You can learn more about this unique program that provides support for psychiatric and mental health nurses from underrepresented backgrounds pursuing their master's and doctoral degrees, and how to apply at emfp.org or email us at mfp@ana.org. Welcome back, Lisvel. We are speaking to Lisvel Matos, Ph.D. doctoral student and MFP scholar at Duke University. So turning now to your academic pursuits, as we were preparing for today's discussion, you mentioned that your scholarly interest when you started your PhD program at Duke University centered around Latina sexual health disparities. Your focus has since shifted. Can I ask you to share what you are researching now and what led to that change?
Absolutely. So my current area of research is understanding the factors that influence sexual health promotion among Latino same-gender loving men. And I use same-gender loving men as a more inclusive term to for men that identify as gay, bisexual, and also other men that have sex with men. This term actually originated in studies in the Black community. Cleo Monago actually coined this term, and it is just a term that kind of moves away from what we traditionally associate with the LGBTQ, and not necessarily moves away. I think that's maybe a wrong way to say it, but kind of allows a space that isn't just what we think of as traditionally LGBTQIA+, which is at times, most of the time, more Eurocentric and does not always include the perspectives of men of color. And so this term kind of is a way to be affirming, but then also is maybe could be used for men of color to have their a space.
Forgive me for prying or pushing
Oh,
further
no.
on this, but you're a woman. You started your focus on health disparities for Latina women, which seems more in line with your personal identity. And then now you're looking at same gender loving men, which is a little bit, I
Yeah.
mean, that's not you. So,
Right.
um,
Yeah. When I started, yes, my interest was in Latina sexual health disparities. And really early on into the program, as I started diving into the literature and learning more about, or trying to learn more about where the research gap was and what I really wanted to focus on, I found that I was quite triggered by the research and the findings. And, a research manuscript is really dense, right? To read. Most people like don't, it's not like something you pick up to read for fun. To see some of the experiences that you've had put down as like a statistical number or, kind of your life experiences sometimes like summed up into a kind of a discussion section or a results section. And like you're looking at kind of what's happened to you. And, you wonder, like, okay, well, how come things turned out this way for me and not that way? And it could have very easily been that way. I think I just was experiencing a lot of emotion and a lot of different kind of things surfaced that I felt like I needed to deal with. And, also being in a setting at Duke University that you feel like it's incredibly high stakes. I mean, it's Duke. And I never even thought I could be here at the PhD level. Yes, I got my master's from there, but it's still Duke. So it just feels like all of this pressure. And then to be triggered emotionally was also one of the reasons that I needed to pivot.
so you picked a very specific and perhaps also triggering subject area or group to study. But why did you decide to focus on same gender loving men and their experiences with HIV?
So at the time I didn't really see it like I was kind of jumping ship. I guess I just kind of saw it as maybe a way of starting my program of research in just a different population because ultimately I've always been interested in improving sexual health outcomes through looking at people's strengths and sexual empowerment and the things that I believe really perpetuate some of the experiences that Latino men and women have, exploring their sexuality and with their sexual health. And so at the time, I didn't necessarily see it that way, but I will say that I guess I had a lot of experiences as a nurse and as a clinician where I did interact with Latino same gender loving men, and I interacted with white same gender loving men. And the freedom of expression, how comfortable they were with talking to me was always very different. And that's not to say that all of my Latino patients looked the same and were the same, but there was always like more of a restraint and what felt like a shame there. And those were things that I really identified with. Like, yes, I'm 100% a cis Hispanic or Latinx woman and I'm heterosexual. And so from those ways, from those identities, I cannot always understand how layered it is to have an identity of being a Latinx same gender loving man. However, some of the cultural factors that oppress us all are really important to understand in within for this population to improve HIV prevention outcomes, but also for the Latinx community more broadly. And some of those factors are obviously the immense stigma that exists around sexuality, the perpetuation of sexual silence. No one in my family ever sat down to have a conversation with me about contraceptives. No one ever talked to me about, becoming sexually active, or it was a don't do that. And that was kind of the conversation. And, from my own experience, the don't do that and feeling made to feel shame was not effective. It was not effective for me. And research shows that it's just not effective. And so for me, this area of research hasn't necessarily been easier in terms of mental health wise, always, but it is also something that I felt like I could begin my career and work through some of the other things that I felt like were triggering me early on in this program, and that it would be something that I could still make a difference in, that I was incredibly passionate about, and that I still care about.
What is the goal or the end aim of your research? What is it that you would like to see when you're finished with your dissertation work, your PhD? How would you like that research to be then applied in the communities that are affected?
Definitely. So, I mean, I think that this is just really my dissertation will really just be the starting point of, what will be kind of my lifelong journey or mission to empower Latinx populations to take control of their sexual health, to understand themselves sexually, to bring a more positive light to sexual health and HIV prevention. And then also, I would love to be a part of, and this is something that I probably will do once I get done with my dissertation, is to bring programs to the community and develop and implement programs designed by the community that the community needs, and bring them to the community to improve some of these outcomes.
And when you say community, do you mean who is the community? Is it the entire Latinx, like people who identify as being Latinx, or same gender loving men?
So it would be to the Latinx community, and it would also be with the focus on same gender loving men. But I think the entire Latinx community is involved. We are Latinos are our collective. We are focused on family is a big aspect, community is a big aspect to us culturally. And so I think that programs that involve the community as well as my target population are going to be so important, because literature and the evidence shows us that social support is one of those main factors that can help people protect people against risk and different circumstances they might be in life. And we also know that Latinx same gender loving men experience a lot of rejection even within their own families and their communities. And so I think that in the future, yes, I want to develop programs specifically geared towards HIV prevention within Latinx same gender loving men, but also I would like programs that increase the awareness and the kind of general sensitivity towards not only sexuality or sexual orientation, but gender inclusivity as well.
I come from a culture and a background which is also very conservative, and in some ways, perhaps even more so than the Latinx community here in America, where you have the way that a man is supposed to be, the way a woman is supposed to be, very defined, and going up against that is going up against a huge institution. It's more than an institution. How do you think you will fare?
Yeah, I mean, it is a lot. I think that, I will do my part. I will do my best to contribute, but you're right. We're up against these depressive social forces that shape our lives, our opportunities, our access to resources, our access to knowledge. So some days thinking about it all, like thinking about like just how powerful, the influence, like you said, of religion, of racism, of homophobia. Some days it feels like, what can I do here? But that's also where I think my experience as a nurse kicks in, and it reminds me of a lot of times I took care of patients that had a lot of things going on, and not just with their illness, but with their lives and their experiences and things they were trying to overcome. And I remember the thank you, like I remember those moments of gratitude that my patients express with me, and how sometimes like that was enough to take me from feeling like, oh my gosh, this is the worst day ever, to feeling like, okay, maybe what I'm doing has a purpose. And so I think that on days where I am thinking about all these societal conditions and how they really affect our lives and how could I possibly make a difference there, I think it's all of us, like all of the MFP scholars, it's everyone kind of like doing this work in this area. And that's how we make a change, by uplifting our participants' voices, uplifting their stories, and also bringing attention and highlighting how these societal conditions are really detrimental to health, mental health, physical health, and sexual health.
Yeah, absolutely. I think one life saved or one life improved is in terms of measuring outcomes, or in terms of measuring, whether you're successful or not. One life is worth it and makes the difference.
Absolutely.
Yeah. You mentioned right now that you had patients who were, in addition to their illness, had other issues that they were facing, and sometimes mental health, psychiatric issues are not necessarily diagnosed or identified as being relevant or
Mhm.
being requiring treatment when somebody's undergoing treatment for other physical ailments. So this leads me to my next question: is if you could perhaps explain the link between HIV prevention and psychiatric mental health.
Yes, absolutely. So, evidence shows us that HIV risk, substance use, and mental health, that those are co-occurring. They kind of cluster together, and Dr. Gonzalez Guarda's work looks at this, and it's called the syndemic, where there's these societal conditions and these diseases that kind of tend to cluster together. And one of the reasons that these two things do go hand in hand and are so important, I think, is because of how societal forces and stigma silence and stigmatize, being gay, being a same gender loving man, and then also having depression or having anxiety. So it's almost like all this triple threat or quadruple threat of oppression. And then if you also are, let's say, an immigrant and are undocumented and you don't have access to care, and so then that becomes another factor that's against you. And so I think that we sometimes in the literature, we kind of look at, well, mental health is, a predictor of HIV risk and HIV, but ultimately, holistically, when we look at it, of course, it makes sense that mental health affects how you regulate other areas of your life. And sometimes that could mean vice versa. And so for me, I think I will always view sexual health as being holistic. And I think any programs that I develop in the future, I would like them to address more than just HIV prevention. And I think they should address other aspects in addition to HIV prevention that are part of sexual health, which includes mental health.
You presented your research at the 2021 Association of Nurses in AIDS Care conference, for which you received the Student Poster Research Award. Congratulations on that.
Thank you. Thank you.
So, what do you think made that poster successful? What were the key takeaways from the work that you presented?
Yeah, absolutely. Honestly, that came as such a shock to me. And
Nice shock.
great
You mean the
shock.
award?
The award, yeah, just the
Yes,
award in
okay.
general. I think Dr. Bonds did talk about imposter syndrome and kind of how we experienced that. And I was in a place going into that ANIC conference where I had an incredible amount of self-doubt just in my work and what I was doing, because I wasn't getting this great amount of feedback, not necessarily from my committee, but just in classes and stuff. And so I was feeling really down, and so that was quite a welcome surprise, and also let me know that I may be on the right track. But what ultimately I do think made my poster successful were my participants, the stories that they shared, the honesty and the trust that they put into me And I think that's what really allowed me to have a successful poster, because I was able to show on my poster the way intersecting forms of stigma and oppression really influence sexual health promotion. And just to kind of give you some background, my study was a qualitative study that interviewed 15 men to understand more about the barriers and facilitators of sexual health promotion in this population. I specifically wanted to interview Latinx same gender loving men that were HIV negative, because I also wanted to understand, okay, well, what are some of the, the strategies and the facilitators as well that have helped them maintain their HIV negative status. And so the amount of information and openness that they had with me really allowed me to depict the way that these forces that we've been talking about, religion, homophobia, socioeconomic factors, immigration status, like how these things really shape our sexual health, our beliefs in ourselves, and how those things impact our sexual health behaviors and ultimately promotion. The other thing that came out of that poster that I also think made it successful was there was an incredibly rich amount of detail around how they had overcome some of these factors. And some of those things to share were things like learning your self-worth, discovering yourself, empowering yourself sexually, finding trusting families or partners to have these experiences with or share things with. And so, yeah, I think a lot of my success was from my participants and just how honest they were with me.
If you could, share with us what the current trends are in terms of HIV infection and HIV spread within the Hispanic Latino community in the United States. Is there cause for concern?
Absolutely. So Latinx, same gender loving men account for approximately 1% of the population in the United States. Those estimates are very rough, but approximately 1%. And in 2019, they accounted for 26% of new HIV infections. And those numbers have been increasing really since the beginning of the HIV epidemic. We know that Black and Latino same gender loving men have been disproportionately affected. But what we have seen in the recent decade is that these trends are actually getting worse. And, we have to ask ourselves why that is. And so one of the factors and one of the things that I'm interested in is actually is PrEP use. And one of the things that we know is that since PrEP was introduced in 2012, Latino men have not been using PrEP as often or as readily as white same gender loving men. And so that is definitely one of the things that I think contribute or, is widening that disparity. So I'm interested in learning ways to why is this happening? So the literature tells us, and we have plenty of evidence that shows that these are access related issues. I mean, a month's supply of Truvada can cost, before they went generic, it was over $1,200 a month. And so if you're uninsured, underinsured, then your chances of being able to afford this, it's not likely. Then we also have provider barriers. We know that providers are less likely to educate Latinx same gender loving men about their options around HIV prevention, specifically around PrEP.
Why is that?
Cultural factors have been cited, as well as implicit biases. The idea that maybe Latinx men are less capable of adhering to treatment, or that they're going to be more risky, that they're going to be more likely to not use condoms once on PrEP. So these implicit biases have been cited as reasons for those disparities. Primary care providers not feeling comfortable to prescribe PrEP and, therefore referring to HIV infection specialists when it's not necessary. The CDC has very clear guidelines on how to manage and prescribe PrEP. It does require men to come in, or patients to come in every 3 months for blood work and HIV labs, as well as renal and kidney function. So it's kind of basic care things. And so That's no different than what you would do, let's say, for a patient with a thyroid condition. You would prescribe them medicine, you'd have them come in and you draw labs and follow their care, even a person with diabetes. And so there is that barrier at the primary care level where there's a lack of education and understanding on how to prescribe and manage PrEP. But again, that is definitely extends to all populations, not just Latinx, same gender loving men.
Thank you very much for that, Lisvel, and we will be right back. You are listening to Mental Health Trailblazers, Psychiatric Nurses Speak Up. There is a critical need for students of all underrepresented ethnic backgrounds to pursue graduate degrees in psychiatric mental health nursing. The Minority Fellowship Program at the American Nurses Association is a federally funded program designed specifically to provide fellowships and mentoring support to students from all underrepresented ethnic backgrounds pursuing master's and doctoral degrees in these fields. Visit emfp.org to learn more and apply. We're speaking with Lisvel Matos, SAMHSA MFP Ph.D. Fellow at Duke University School of Nursing. So switching gears here a little bit, Lisvel, I have a series of questions for which I'm hoping to get short tweet-sized responses. So first off, who is your nursing hero and why?
Absolutely. My nursing hero is my mentor, Dr. Rosa Gonzalez-Guarda. She is my hero, not just because she's my mentor, but because of the type of person and nurse scientist that she is. She is someone that brings people together and genuinely cares about making a difference in this world.
Okay, I think you're the first person who's mentioned a hero that I actually have met, at least virtually. Okay, and as you're pursuing your doctorate degree, you're no longer practicing. What do you miss most about nursing practice?
Oh, I miss the patients. Patients used to bring so much joy to my day. When you're sitting here and you're working on a paper or something, you don't know how this might impact someone's life. But when you're working on the floor, you can see it. You see the difference that you're making. And so that's what I really miss.
While you're not seeing patients now, you are researching, you're doing research with a very particular group of individuals who come from, challenging background in terms of culture and how they fit in with their community. How are they seeing your work? And does their feedback sometimes, provide that kind of affirmation that you got from patients?
Yeah, absolutely. Absolutely. When I interact with my participants and I am able to see, number one, who it is that I'm trying to help. And also just the enthusiasm that all of my participants had to participate or to be a part of my qualitative study was incredible. They were just so grateful and eager to be a part of something that could possibly make a difference within their community. And that for me made all the difference and let me know, like, you are helping people this way. It just looks differently than the bedside.
For them, was this something totally unique? Have they ever heard of anybody doing something similar?
Most of my participants had not heard of or been a part of any research that involved Latinx same gender loving men.
It's been several years now since you started your PhD program. What is the first thing that you'll do when you graduate?
Sleep?
Okay.
No, I mean, take a load off. I probably get on a plane. I'm going to get on a plane. I'm sure I'm going to have something planned to go to a beach somewhere. It doesn't even have to be out of the country, but just go sit down somewhere with a tropical drink.
You must really miss Miami.
I miss Miami all the time. Yes.
And then one piece of advice that you wish someone had told you before starting your PhD program.
This is a journey, not just a professional one, academic one. It is a personal journey as well. For me, I have learned just as much about myself during this journey as I have about my, within my classes. Like we talked about earlier, I had no idea that there were some things that I experienced as a young woman that were going to trigger me in the way that they did when I was reading the literature. I was already in therapy, but I continued therapy throughout this process. I have just grown incredibly And so that is something that I was not prepared for. I thought I was just going to school one more time to get another degree. That's just what I thought I was doing. But instead, it's just been this beautiful self-discovery process that I feel like just has made me a stronger person and has helped me know myself better as well.
Yeah. I mean, I guess if you are getting fulfillment and satisfaction from the work that you're doing, then absolutely it is therapeutic. So, one question that I did not include or I did not share or discuss with you previously, but that I think we would be remiss not to discuss here, and this is something that has come up in the media and the general public discourse over the past few days, is this bombshell revelation that came from the Supreme Court. So, I was just wondering what your reactions have been to that.
It has been a gut-wrenching thought. So I will share that I had an abortion at 19, and I did that in the middle of my nursing program. And it was something that I needed to do because I also had an abusive partner at the time. And if I had not been able to make that decision for myself, if I had not been able to kind of do what was needed for me, that pregnancy, my life, I don't know that I'd be sitting here having this conversation with you. And one thing that always has struck me about my experience was that there were people picketing and yelling egregious things to me during one of the most difficult, and still is one of the most difficult days of my life. And so the thought that we're moving backwards in this country, the fact that we're going to make it so that women like me, that have to make a decision for their own personal reasons, for their body, for their life, are going to have to suffer through whatever consequences or whatever policies get put into place in their states. It just really makes me scared, and it makes me sad, and it makes me angry about where we are in our country in terms of sexual and reproductive health rights, and that it just feels like they are going away.
Yes, they're definitely under siege. Thank you for sharing that, Lisvel. Very important reflection.
For me, part of my journey and my growth is not allowing people to make me feel shame about my experiences. And so when I had that abortion, I was in nursing school, and they were threatening to kick me out because they didn't know what was going on with me. And I didn't feel like I could share that I needed to have an abortion because it's a stigmatized topic.
What you just said now is also really, really important, that this is something that female students, whether in nursing school or any other kind of career track, have to deal with. And the educational establishments, they need to realize that, people are people. People are going to be sexually active, and, pregnancies are going to happen. And being able to be empathetic and not judgmental is a critical part of making sure that students succeed. So, yeah, very important.
Yeah, absolutely. And I guess I'll just share that, had it not been for the director of the program at the time taking me into her office in private and basically telling me that I had nothing to be ashamed about, and that I needed to take time to take the semester off and come back a stronger version of myself. Had it not been for that, I think they would have kicked me out of the program, because that was where those conversations were heading. And it was just all because I, had a couple tardies here and there to class. And obviously I was dealing with a difficult situation. And so because of the shame around the procedure that I had, I 100% did not feel comfortable to share with my faculty at all. So,
Yeah. All right. Thank you very much for that, Lisbel. Very important point. Now turning to your experience with the Minority Fellowship Program, how did you first learn about it?
I learned about the MFP program from an MFP alum, Dr. Gonzalez Gorda.
And how important has it been to your studies?
The MFP program has been integral to my studies. I have the support that I've received and the connections that I've made through MFP have been invaluable. It's just also a space where I feel that I could see other people that look like me and people that have had similar experiences to mine. And it's just such a warm, supportive space.
What would you say to students who are now either doing their bachelor's degrees, thinking of moving, to advanced practice degrees, or to people who are in their master's or doctoral programs who might be considering applying? What would you advise them?
I would tell them to do it. I would tell them that applying to the MFP was the best decision that I made. And I would also say, don't worry if you don't get in the first time. Apply again the next year, because that's what happened to me. So
Finally, now, as we are wrapping up, I'm thinking back to our discussion earlier this week. Well, you spoke about the privilege of being able to research and address the issues that you find important to you. What are some of your thoughts as you think back on your journey, where you started, where you are now, and then your vision for the future?
yeah, I think I said surreal earlier. Yeah. So where I started not even knowing how to apply for college, and even becoming a nurse. It was like, well, what am I going to do? What am I going to be? What kind of nursing am I going to do? And thinking about where I am now, it's humbling. I mean, when I became a nurse, everybody said you work the bedside. Basically, you're supposed to be at the bedside for your whole life, like 40 years, 50 years. And that's where I thought I was going to be. And then I was like, nope, not doing this. And then I was like, okay, well, I'll go, become a nurse practitioner. And I thought I was going to be seeing patients, Monday through Friday, and that's what my life would look like. And I never thought that I could call myself a scientist or be a researcher or do what I'm doing now. And so when I think about kind of that evolution, I'm just incredibly grateful. And I feel like it is a privilege to be here, because I think that if the cards had shook out a little bit differently, that I don't know that I'd be here. I really want to see a future where sexual health and sexuality is not a taboo topic, where we aren't silencing people and restricting people or shaming people for who they are, who they love, and what they do in the privacy of their bedroom. I would love to see a future where we empower individuals and provide people with knowledge rather than shame.
Yes, thank you very much for that, Lisvel. I think that would be a much happier world than the one we are living in right now. And with that, we have a wrap. It's been a huge pleasure. Thank you so much.
Thank you.
And that does it for this episode of Mental Health Trailblazers, Psychiatric Nurses Speak Up. I hope you've enjoyed our discussion, and I look forward to you joining us on future episodes. This is the Minority Fellowship Program at the American Nurses Association podcast, featuring nurse scientists addressing the psychiatric and mental health issues affecting underrepresented communities across America. You can always find us online at emfp.org and wherever you get your favorite podcasts. The views expressed by the speakers and host do not necessarily reflect the official policies of the Department of Health and Human Services, nor does mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government.